Hi, good day to all of you. Welcome to the Part 1 intensive course organized by the Department of Ophthalmology HUKM. My name is M.H. Yong, one of the lecturers in the department. I was given the topic of ocular motility. I'll try my best to bring you to the physio-anatomy of the ocular motility. First of all, I would like to start with some questions. Don't worry, this is not a rapid fire sections for the Q&A. The purpose is to, first of all, let you know what are the common questions. Hopefully, we create some filing in your mind before we go to the details. Okay, I'm showing you here some of the common questions in the physio-anatomy of the ocular motility. So sometimes we can ask you something with a very big picture. Just ask you what is the afferent visual system. Yeah, sometimes we can ask you something in the slightly details and also a certain anatomy. So usually it depends on what kind of exam that you're dealing with. In the YY exam, basically we can ask you any of this. But usually in the short notes or even the essay, usually we give you a very small details topic. For example, we ask you what is orbital apex. Yeah, what is the anatomy of the certain cranial nerve. The other physiology question is the specific function of the eye movement. We can ask you, tell us regarding the horizontal gaze, tell us about the vertical gaze, and also the other individual ocular movement functions like saccade and persuade. Okay. The other common question is like loss in the ocular motility. Okay. Some other pathogenesis and also pathology questions is also related to the ocular motility. This slide is showing you some of the example of the MCQ questions. Okay, usually MCQ questions should be more details, require some of the details information from your readings. Okay, but sometimes it can be quite a general statement as well. Okay, for to test your basic understanding. Okay, here are just some of the examples. Okay, this list is not that it's all the so-called partial question or anything. No, yeah, but it's just to give you ideas. Actually, what is a common thing that we always like to ask. Okay. The next slide actually showing you some even more details MCQ question that I will be able to ask you. Okay, so usually anatomy questions, the difficult part will be how deep that you need to go through the text and also the knowledge for you to prepare for the MCQs. Okay, so here are some of the examples that I hopefully will give you some insight regarding how details that you may need to read. Okay, so in the certain parts of the anatomy, you are that in charge of certain functions. There are some of the so-called the hard fact that we like to ask. Okay, the locations of the anatomy that in charge of certain things. Okay, so these are the hard fact that usually you have no way to argue that this or no way to make it controversial. So you become a so-called as a classic example of your MCQ questions. Okay, example number 3. Yeah, sometimes also the examiner like to test your knowledge. Whether you know the other terminology, even though you know that fundal eye field is in charge of the saccade movement, but sometimes they may test you or other terminology of the fundal eye field itself. Okay, so these are the example that the questions that we like to ask you. Okay, back to my lecture today. The outline of my lecture is very simple. First of all, we will discuss about the terminology and also the laws we use in the ocular motility. Second, we will discuss about the anatomy. So classically, we divide it to supranuclear and also the infranuclear compartment. So that we will discuss about the anatomy that involved in each compartment. After that, we will discuss about the physiology and also the chronicle. Also, we divide it to the supranuclear and also the infranuclear compartment as well. So when you're describing the ocular movement, yeah, you should know that whether you are describing is a monocular movement or binocular movement. So when you are describing the movement of one eye, the word that you should use is adductions. So the common one is the abduction and also the adductions, and also the supraduction and also the infraductions. Okay, we can replace with other terminology for the supraductions because elevations. The other word is circumductions, also equal to the meaning of the supraductions. How about infraductions? Infraductions also called as a depressions, also called as a dorsum duction as well. Okay, do we have any other ductions movement for one eye? Yes, we have. How about your intorsions and also the extorsions? They can use to describe one eye as well. So intorsion basically we call as an inside core ductions, and also the extorsion we call as the exside core ductions. So there are the other terminology used in the monocular eye movement. I'm not here to spoon feed you with all the definitions of all this, but these are the common things that you should know. Agonist, what is the meaning of the agonist? Synergist, antagonist, and also the Sherrington law that used to describe one eye movement as well. So how about binocular eye movement? The first thing to understand is a conjugate. Okay, conjugate means that the movement is in the same direction. So is all binocular eye movement a conjugate movement? No, not necessarily. Yeah, in the binocular eye movement, it further divide to two. One is a conjugate eye movement because of versions. The other thing is a disconjugate eye movement. They actually act in a different direction. Is a versions. Okay. So in the versions, when you are looking to the right, we call it as a dextral versions. Looking to the left is called as a leval versions. Looking up, same like the duction as well. We can use either is a sesame versions or supra versions, or this as simple as an elevation should be accepted word as well. So when looking down, we call it as infra versions, depression of both eye, or you can use a diosome version as well. How about looking up and left? You just combine the two words together. So you want to look up and also the left, it will be a leval supra versions of two eye or leval supra ductions of the one eye as well. Okay. So the other thing is a vergence. So you should know there is a convergence and also the divergence. So these are they're working in a different direction of different direction of the movement. Okay. So when you describe binocular eye movement, the laws that actually so-called govern the movement is a Herring laws. Okay, so Herring's law apply the knowledge of your yoke muscles. Okay, same as well. You should know the definitions of this terminology as well. Yeah, this is the other slide regarding binocular eye movement. I think some of you may be wondering what is the difference between version, vergence, and also the gaze. Okay, when you talk about the versions and also vergence, we talk about the movement in one direction itself, whether your eyes move up or move out or move down. Okay, gaze actually have two different components. So when you want to perform a gaze, basically you need to move first. Okay, so you're shifting your gaze. At the same time, also it's not finished. And so after you shift the gaze, you need to stabilize and hold your gaze to achieve the so-called the target of your movement. Okay, so gaze involves gaze shifting and also gaze stabilizations. Okay, so it means that your eye have to move to one side. At the same time, you have to focus and also put the object to your fovea. Then only we consider this a complete movement of your gaze. Okay. So how about the functional system? Yeah, make you more confusing. Okay, so basically there are 6 functional systems that we need to discuss later. The fixations, vestibular ocular reflex, optokinetic, smooth pursuit, saccades movement, and also the vergence. Okay, all these 6 functional systems important because of they represent a different pathway and also the different physio-anatomy system that are able to for you to perform this different system. So very important for you to able to recognize them. Okay, at least know how to recognize them, and also we also may need to some knowledge to how to check them when they have a defect. Okay, so to put it in a simple way, the functional system of your eye movement basically is something like a different type of the dance. Okay, so it's also still an eye movement, just like how you dance, but there are different way of to do a dancing. Okay, so you have to recognize which dance is this type, which okay, then you're able to recognize the so-called the behind story of the movement. So beside Sheridan and Herring laws, there are the other 2 laws because the Donder and listing laws that I can use the word govern the movement, but it's to describe the eye movement. Okay, because they are not super right, and also I don't think it's a very important. Okay, but it's my duty to explain to you all. Okay, so the Donder law, and also the listing law, basically they are describing the same thing. Okay, so first of all, you have to understand our eye movement. Either it's a one eye or both eye movement. Okay, the movement of your eye is always respect the meridian, the horizontal and also the vertical meridian of your eye. Okay, so imagine your eyeball, there is a vertical and also horizontal meridians. Okay, so whenever you want to move up and also move down, move to left, move to right, the center of the meridian is respected. Okay, so you cannot move up and move down, move to a sideway like this one. Okay, so when you want to move up and also the left, okay, is the way that you move. Okay, move to left first then up, or move to up first then left. Okay, so this is the law that describes this type of movement. Okay, sometimes it's quite easy to understand, but to the sentence and also words is for me is quite difficult. That's why I copy paste the content that I copy from the internet for you all. Okay, so listing law also describing the same thing as well. So the keywords here is all the movement from the primary position, either Donder or the listing. Yeah, they're respecting their meridian. Okay, some people call it a horizontal or vertical meridian. Some people call it a horizontal vertical retina meridians. Okay, basically they're respecting this kind of meridians. Okay, and there's no torsions. Okay, so your eyeball within your socket is up, down, left, right, up, left, up, right. Okay, but they are not tilting to the other side or moving out from the socket to the other side. Okay, that's what I understand regarding a Donder and listing law. Okay, so let's move on to the anatomy of your ocular motility. Okay, so we start with the topmost of the system, which is your cerebral cortex, and then all the way down until your extraocular muscle itself. Okay, so this whole system from the top until your extraocular muscle, as we mentioned before, the easiest way we have to further divide them to the supranuclear and also the infranuclear system. Okay, so supranuclear system further divide them to the cerebral cortex, the brainstem, okay, and also another supporting system in your supranuclear pathway is a vestibulocerebellum system. Okay, so infranuclear is something that you all will be very familiar because it's so-called they are the common questions that you all will know much better than me. Okay, so the demarcation line is from the nucleus and beyond. Okay, so from the nucleus that involved in the eye movement, you know there is a 3, 4, 6. The nerve, the pathway, the course of along your or the cranial nerve until your neuromuscular junctions and also until your extraocular muscle itself. Okay, so they are considered infranuclear system of your ocular movement. Okay, back to the supranuclear anatomy. So in the cerebral cortex, there are different important structures that we will describe later. Okay, sometimes the important thing for you all also is I mean as a student, you know that what is the limit that we need to go to for your readings. Okay, in the neuro-ophthalmic field, I believe that they are never have ending for your readings. Okay, you want to read in details of the basal ganglia and superior collicular scan. You may need one day to understand regarding all these things. Yeah, I think my duty here, hopefully I will be able to give you a very big pictures and easy way to understand and easy way to explain to your examiner or even your colleague regarding the system as well. Okay, so usually in the cerebral cortex, we also have one group of the system is a subcortex. Okay, this subcortex, the functionality will describe further. So the other thing after the cortex, most of the pathway will go to the brainstem. Okay, so we'll tell you what is the thing in the brainstem as well that important for the ocular movement, and also what is the role of the supporting system like vestibular cerebral system in controlling or in so-called the modifying your ocular movement. Okay, infranuclear, as mentioned, is something that very common. I think as I mentioned, usually is some more common question they ask you because they are something that more near to the eye maybe. Okay, that's why you all know it better. Okay, let's move on to the physiology part of the ocular motility. For the physiology part, we also will approach with the same way. We use the anatomy approach. We start with the topmost first. Okay. So in the topmost of the cerebral cortex, this slide will be quite complicated for you all. I don't think we require you all to remember every single details of this thing, but you have to recognize what is the most important thing. For me, very simple: frontal eye field and also the temporal lobe. Okay. So the supranuclear control in the cortex for your eye movement. First of all, there are two important so-called functional classes that you need to know that in charge by your cerebral cortex. One is the saccades movement, one is the pursuit movement. Please remember this functional class is how your eye move itself. Okay, so this saccade and pursuit, they can move horizontally and also the vertically. Okay, but same as well, as long as you want to start with the saccade and pursuit movement, the starting point is actually in the cerebral cortex. So which part of your cerebral cortex? So saccades, frontal eye field. Okay, where is the location of the frontal eye field? In the frontal lobe. Okay, so whether there is any other location that in charge of the saccade? Yes, there are supplemental eye field in the frontal eye lobe, and also there are parietal lobe as well. Okay, and particularly in the posterior parietal cortex. Okay, but they are not so important. Okay, but you can definitely mention it during your exam or during your discussions. Okay, but the most important point that we cannot miss is the frontal eye field or the frontal lobe in charge of the saccade movement. Okay, how about pursuit? Okay, so pursuit, there are different different locations that described by different books. Okay, even the our standard textbook AO may describe differently as well. Okay, the most important thing is a share in the common is a temporal lobe. Okay, so it can be a temporal lobe in the junction of the parietal occipital temporal (POT) or in the medial temporal or medial superior temporal. Okay, to make simple, smooth pursuit in charge by the temporal lobe. Okay, I hope you are still with me. Okay, we are moving to the next level now. It's a subcortex level. Okay, So this level is something that people always miss, okay? Because I believe that is a bit complicated. It's very complicated for me as well. But you can never miss something in between when we decide something pathway. Same like we ask you how to go from UM to UKM. You can just tell me, okay, go to Federal Highway. Okay, after that you will reach to UKM. No, we cannot say like that. But you not need to display two details as well. You not need to tell me, hey, in the first junction you turn left, first junction you turn right. So the best way to do it is understand the concept, and also sometimes we can group it together. So whenever the impulse come from your cortex, just as we discussed just now, they always go to your subcortex first. Okay. So what the subcortex structures? They are basal ganglia, thalamus, and superior colliculus. In the saccades and pursuit, they share the common subcortex structures. And what they do, they basically just do some processing, relaying, and also the filtering of the impulse. Okay, I believe that's all that you need to mention for you to describe any type of the eye movement, especially saccade and also the pursuit. Okay, so how about internal capsule? Internal capsule is a bit specific to your pursuit movement, okay, and not so much involved in the saccades. Okay, so for those who have the stroke that commonly involved in the internal capsule, you need to understand this kind of patients that will have difficulty in doing the pursuit. Okay, that's why sometimes you may notice they are very difficult to follow your command to do the extraocular muscle examinations. Okay, hopefully now you're able to understand the concept behind this. Okay, we are now moving on to the more interesting part of the eye movement, the brainstem. Okay, so if I ask you questions regarding the brainstem, which part is important for your eye movement, definitely first of all you will start with giving me some example of the PPRF, the pala medium pons, Pondan reticular formations, and then you may heard of INC, interstitial nucleus of Kaj's, and then the rostra interstitial nucleus of MLF. Okay, but how about the others? Do you able to remember every single of them? Yeah, I believe no. I myself cannot. Okay, you ask me what is all these things, I have no idea to give you. Okay, yeah. So the important thing is you need to group it together and remember the pictures. Okay. In fact, they are actually they are already in the grouping. Okay, so tell me the big group first before you go into the very small little details. Okay, so in the brainstem, first of all, divide them to three according to your compartment. Your brainstem, we have midbrain, pons, and also medulla. Okay, so each compartment of it there is reticular formations. This reticular formation is a group of the nucleus together with all the nucleus pathway and also the tract. So they form a networking. Okay. So in the midbrain, there is a mesencephalic reticular formation in the midbrain. In the pons, there are the PPRF, the paramedian pondan reticular formations. In the medulla, there is a medullary reticular formations. Okay, so each of these reticular formation in charge of the certain movement of your eye. Okay, so the important thing is this midbrain, in a general picture, they're in charge of your gaze. Okay, so you talk about the gaze control and gaze center. Most of them are situated in your brainstem. Okay, so which part of the brainstem? Okay, so in the midbrain, as mentioned, the mesencephalic reticular formation in charge of vertical and torsional gaze. So the most important is a vertical here. Okay, so the pons, as you all know, the most familiar because this is the most common questions. So it's a paramedian pondan reticular formation in your pons. Is the horizontal gaze center. Okay, but at the same time, the medullary reticular formation does supplement the horizontal gaze as well. Okay, how is supplement? It inhibit the unnecessary impulse that initially in charge by your PPRF. Okay, so in the brainstem, you talk about the gaze center and talk about the reticular formation that in charge of the certain gaze. Okay, so after talking about the reticular formations that in charge of either your vertical or horizontal gaze, they are the gaze centers. Then we talk about the structures in your reticular formations. So okay, so don't worry about all these so-called the terminologies and also the terms that really make you more confused and make you feel that you really in this stage you want to close the book and go to rest. Okay, so understand them step by step and one by one. So now you know the reticular formation is so simple, and then the next thing that you need to read a bit more is what is the structures in the reticular formations in these structures. Okay, so in the reticular formation, basically they consist of the neurons and also the tracts. Okay, so as long as you know that the certain neurons and certain tracts belong to your midbrain, then you know that they are the one part of your mesencephalic reticular formations, and they're in charge most of the time is the vertical gaze. Okay, as I mentioned to you, first of all in the cortex, your brain will decide whether I want to perform saccade and pursuit first, okay? Then only they go to your brainstem to decide whether they want to move horizontally or vertically, okay? So they are combination of it, okay? So in the midbrain, whatever circuit or pursuit movement they want to go to the vertical movement, they go to the brainstem, okay? That's why in the brainstem there is some individual structures, okay, for you to move. Either is a for the circuit movement or either is a pursuit movement, okay? So that's why we put over here. Then you can see Y group cells in many is a pursuit, okay? The other thing of your IMLF and INC, there are many is the circuit movement, okay? But one is excitatory, one is inhibitory. If you ask me whether is this really important, yeah, is it really doable to remember or not? For me, it's actually no. Yeah, but unfortunately, we will ask you some of the questions, but definitely you will not feel your MCQ or anything just because of you don't know this thing in details, okay? So no worry and try your best, okay? So by understand the big structures and go to the small little details, it will make it much easier for you to remember, okay? So midbrain is a vertical center. So if you want to have a pursuit movement in the vertical pursuit, the cells that should be inside is the Y group cells, okay? You want to have a circuit movement, there are two group of nucleus that work together. One is a rostral interdicial nucleus, that is an excitatory nucleus. Interdicial nucleus of Kj is an inhibitory nucleus. So by this, the balancing between these two nucleus, then only you have a smooth movement, okay? So how about pons? Okay, first remember pons, PPRF, is a horizontal gaze center, okay? Against some of them in charge of the smooth, some of them inside of the circuit movement, okay? Same thing for medulla. So medullary reticular formations in general, they are the inhibitor for your horizontal gaze, okay? Okay, next we move on to the tracts in your brainstem, okay? So just as I mentioned, in the reticular formations, there are different neurons that they are compartmentalized in the different reticular formations. Tract is different. Tracts, they are actually everywhere in the brainstem, okay? They are not really compartmentalized to only in charge of certain gaze, okay? So this is the first principle to remember, okay? So when you talk about medial longitudinal fasciculus, when you want to talk about the connection first, basically it connect everything. So whatever impulse and also the pathway from your cortex, subcortex, and also your reticular formations, either your vertical one or the horizontal one, will connect to the MLF. Then after that, how you move the eye, you have to connect to the cranial nerve that in charge. Okay, so MLF, when we talk about the horizontal gaze, yeah, then your brain say that I want to move horizontally, so you will go to the PPIF. Okay, this MLF you have to connect to your sixth cranial nerve, at the same time also go to the third cranial nerve. Okay, so most of the time, certain book actually mentions that the signal of the go to your PPIF. On the PPIF, you straight away go to sixth cranial nerve first. Okay, at the same time, go by your MLF, you go to your ipsilateral third cranial nerve. Okay, so this MLF in charge of the movement at the end from your horizontal gaze center to tell your cranial nerve what to do. Okay, so does it involve in the vertical gaze as well? Yes. Okay, so the vestibular system is the one that tell your MLF, okay, to work vertically and horizontally when there is a need for your vestibular system to activate. Okay, posterior commissure is more particular to the vertical movement because most of the fibers actually is located in your midbrain. Okay, so the neurons actually not only INC, the main one is INC, but at the same time also you go to other neurons in your midbrain, and then you go to other cranial nerve for it to move vertically. Okay, you don't move horizontally, usually it's only involve third and sixth nerve. When you want to move vertically, basically you have to involving 3, 4, and 6 nerve. Okay, so there are the other small little tracks that sometimes you may need to remember as well, but I won't go into details here. Okay, now I hope you have some idea regarding the control from your cortex, subcortex, brainstem, especially the reticular formations. Okay, now we just left with some we call it a small little players in your supranuclear control, the cerebellum and also the vestibular. Okay, so put it a very simple way, cerebellum is mainly is a filtering and also the processing unit for all kind of eye movement. It's almost similar like your subcortex. Okay, so in a cerebellum there are look like a small little player, but don't forget to mention them. Okay, one thing, you don't let them too sad because they are still one of the player. Another thing is you can apply in any type of the movement that you are going to discuss. When you talk about the pursuit, circuit, vertical or horizontal, at the end you still need to go to the cerebellum and knock the door, say hello cerebellum, I'm going to the cranial nerve now. Okay, Yeah, so help me to filter, relay, and process whatever information that I have. Okay, that's all you need to remember. So cerebellum play a role in the ocular motility by doing a filtering and processing function as well. Okay, so which part of the cerebellum? Okay, I cannot remember again. Okay, but it will be good for you to have an idea and possible to remember it. Okay, unfortunately, anatomy at the end it requires some memorizing. Okay. How about vestibular? Okay, vestibular nucleus in the brainstem also contribute. Okay, yeah, you know that these are the so-called the eight cranial nerve. Okay, so we even though that it's not a very popular topic, but the only way your eight cranial nerve and nucleus are involved in the eye is by these reactions or reflex, because of vestibular ocular reflex. Okay, basically it just means that whenever you move your body and also your head will move. Okay, by moving your head, your eye have to move to so-called the counteract the actions of your head movement, so that you can able to maintain your fixation and look at whatever you're looking at now. Okay, how we do so is by the VOR reflex system. Okay, so in the vestibular nucleus, they are located in the pons and medulla in your brainstem, and also there are certain it receive impulse from the semicircular canal by the angular eye movement, and also angular head movement, and receive impulse from the utricle and sacule by your linear or head tilting eye movement. Okay, for the VOR, we have another slide at the end of these presentations to talk about details of the VOR as well. Yay, we have finished the supranuclear compartment of the ocular motility control. So remember, start with the cerebral cortex and then go to your cortex, and also go to your brainstem. In the brainstem, there are reticular formations, there are neurons in the reticular formations, and also there are the tracts in the reticular formations. Okay, at the same time, there are some supporting system, for example, the cerebellum and also the vestibular nucleus, which supporting the running of all these impulse and also the movement. Okay, so rephrase again whenever we ask you certain movement, especially the voluntary movement, whether you want to move in the vertical and horizontal. So you know that the main player that you want to mention is the gaze center in the horizontal and also the vertical gaze center. Okay, but you have to mention whatever the impulse that come from the cortex as well. So you know that when your occipital cortex is the one that your visual afferent system say that, okay, look, I need to see something vertically. Okay, so then you have to decide whether this is a circuit and persuade from your cortex first, then only go to your vertical gaze center. Okay, then the discussion, even though mainly is over the horizontal or vertical gaze centers, but you still need to mention from the very beginning of your cortex and also the subcortex, then go to your vertical gaze center, and how your vertical gaze center go to all the neurons, and also all the tracts go to your cranial nerve at the end and move it. So same thing if you ask you the other way, well, how the eye move in the to perform the circuit. Okay, so the focus will be in your cortex. Which part of your cortex is the one that is responsible for your circuit? But at the end also, when you go to the brainstem, from the beginning, you will decide whether this circuit impulse will go to your vertical and also horizontal gaze center first. Okay, because your brain have to mean that I want to move circuit, but you have to ask your brain to, okay, now you have to decide to me, you want to move circuit vertically or horizontally. Okay, only your fundal eye field, okay, at side, then go to a subcortex to so-called to modify it, and then go to your brainstem of the horizontal gaze center to move it in the circuit horizontal movement by certain neurons that in charge of the things. Okay, then after that, go to your PPRF, MLF, go to a third nerve and sixth nerve to move it horizontally. Okay, let's move on now to the infranuclear structures that are responsible for your eye movement. Okay, I believe you all may need a rest now, but not for me because this is a recorded video. Okay, so the infranuclear structures start with the nucleus of your cranial nerve. The 3, 4, and 6 cranial nerve is responsible for your eye movement. Okay, this one I don't think I need to further explain to you all. So for the next one is regarding the anatomy of your cranial nerve. Okay, so definitely we are not going to discuss in details. Okay, this one is I have to say that is most of the time is a memorizing words. Okay, so you can just need to go to one of the textbook. Okay, do a short notes of your anatomy of 3, 4, 6. Okay, here are some advice that I would like you to try your best to compartment your anatomy of your cranial nerve so-called the answer when we ask you the anatomy. Yeah, according to their function first. Tell me about the functions. Okay, so tell me about the location of their nuclei. Okay, so in the which part of your brainstem. And important thing is about the connections. Okay, so connection is very simple. So talk about the supranuclear connection first. Yeah, as I mentioned to you, compartment them with the cortex, subcortex, and also reticular formation. Basically, they involve every single thing. So you can just mention to me, all these cranial nerve connect to the cortex, connect to the subcortex. You can give me some example, and connect to all the reticular formations. Can give me some example as well. And then after that, also you connect to other cranial nerve through the tracts, for example, the medial longitudinal fasciculus, okay? And also it receives some impulse from your cerebellum and also the vestibular system as well, okay? So whatever we mentioned just now, you can put it in your connections of your cranial nerve, okay? So the other thing, important thing is the cause and also the relationship of your cranial nerve when it come out from your brainstem until the extraocular muscle, okay? So classically in the 3, 4, and 6, they show the common way to so-called to classify them. You can classify the cause start from the nucleus of the location of the nucleus and then the fasciculus compartment. So the fasciculus compartment basically is when they come out from the nucleus, and also the cause, how they run in the brainstem itself. Okay, so when they come out from the brainstem in the subauditory space, we call as the basilar cause of the cranial nerve. Okay, after that, all of them you go to a cavernous sinus. So you have to tell me the location in the cavernous sinus of the certain cranial nerve, whether they are in the middle or they are in the wall. Okay, so they are above of what are the cranial nerve, or below what are the cranial nerve or structures. Okay. After that, they go to your infraorbital space, and in the middle of the cavernous sinus and infraorbital, there is a SOF, superior orbital fissures. Okay, so you have to know as well the relationship between all these cranial nerve, and then at the end it's not stopped there as well. Okay, you have to tell me at the end all these cranial nerve how they insert in the extraocular muscle as well. So they either is above or below of the extraocular muscle, or inner or outer surface of the extraocular muscle. Okay. And at the end only you tell us regarding the clinical relevance of the cranial nerve that you mentioned, or 1 or 2 example will be good enough. Okay, so part 1 questions don't focus too much on the clinical relevance, but you need to mention it so that we know that or whatever you mention for so much of the thing that you mentioned, they are actually impose a clinical relevance that we need to use in our clinical practice. Okay, look like we are moving to the final structures, the extraocular muscle. Okay, so don't worry about how many extraocular muscle that in the eye. Okay, so yeah, so basically there are 7 extraocular muscle, including your radial pupilla superioris. Okay, but we have only 6 extraocular muscle that move your eyeball. Okay, so there are 6 EOM that move your eyeball, but totally there are 7 extraocular muscle. Out of these 6 extraocular muscle, there are 4 rectus muscle and 2 oblique muscles. Okay, so we can ask you anyway. We can ask you, tell me about extraocular muscle, or tell me about the rectus muscle, and tell me about the oblique muscle, or we can ask you, tell me about the certain one particular muscle, for example your inferior oblique or medial rectus. Okay, so I'm skipping the neuromuscular junction here actually. Okay, please allow me to skip that, but it's something that you may need to know. Okay, even though we seldom ask you tell us regarding the physiology in your neuromuscular junctions. Okay, but you know that this physiology will be need to be applied in the pathogenesis of your myasthenia gravis. Okay, so it's something that you need to know as well. The anatomy of the extraocular muscle is a very super classical questions that you only will be able to get the answer from the books. So whatever you're able to get from the books for you to memorize is not something that we're going to discuss over here. But this is the general template that I would like to recommend to you all when you answer the question of the anatomy of the EOM. So always start with some introductions, the functions of your EOM, and then followed by the empyro. Okay, the empyrology, you can use a very generous statement for all the EOM. Yeah, you can mention that their origin is from the mesoderm, start 5 weeks. Okay, and then it haven't complete the migration until 2 years. Yeah, until the insertion of in your eyeball to form the circle of T-lobes. Okay. So talk about the functions. Okay, some of the EOM have primary, secondary, and tertiary functions. Some of the EOM will have only 1 functions. So microscopic and microscopic. Okay, so microscopic, later we show you a table. You can get the table from your AO textbook. So just follow the textbook, talk about the origin, the cost, the insertions, the size, the blood supply, and also the innovations. Okay, just by all the keywords, you will get most of the points that so-called the important things for your EOM. Microscopic is something that people normally miss. Okay, so microscopic, yeah, you can use the, yeah, you shouldn't miss it because the microscopic characteristic is applied almost the same for all the extraocular muscle. Okay, so get some notes regarding the characteristic of the fibers, the type of the fibers, and also content of the fiber cell and surroundings. Okay, then they will be covered the microscopic anatomy of your extraocular muscle. Okay, this is the table that I mentioned to you just now for the description of the anatomy of the extraocular muscle. This table itself already consists of all the important points that you need to put in for your anatomy answer. Okay, how to memorize it better? I have no idea. You just need to memorize it. Okay. Okay, now we talk in details regarding the physiology functions of your extraocular muscle. Okay, so in the top part, there is a very common table for you to so-called to memorize the primary, secondary, and tertiary actions of your extraocular muscle. Okay, this is something that you need to mention even in the anatomy questions. So the extraocular muscle is easier to divide them to the rectus muscle first and also the oblique. So rectus muscle divided further to the horizontal rectus or is a vertical rectus muscle. So horizontal rectus muscle is only have a primary actions, whether it's adductions or abductions. Okay, so straightforward. So for the vertical rectus muscle, yeah, they have a primary, secondary, and tertiary actions. Okay, so inferior rectus and superior rectus, that the primary actions is either is a depression or elevations. Okay, then the secondary is a torsion movement. Then after that only is a abduction or adductions. Okay, so inferior oblique and also the superior oblique, the primary action is actually a torsion first. Okay, so how do you really remember that? Okay, there are many ways. Okay, easier way is memorize it. Okay, so the other way is over here. So you have to remember the superior muscles are all in torsions. That's why your superior oblique and superior rectus, they are in torsions. Okay, but you know that oblique muscle primary is a torsion first. Okay, then for the rectus muscle, the superior one, the intorsion becomes secondary. Okay, so the inferior muscle extruder as mentioned. So the vertical rectus muscle are all abductor. Okay, and the oblique muscle are all abductor. Sorry, the vertical muscle are all adductor, the oblique muscle are abductors. Okay, so these are the thing. Later, actually, we will explain to you how to memorize it better. Not to memorize it, to actually understand it. So that in case that you cannot memorize it, you still have a way to answer it. Okay, the below picture actually to confuse you all. Okay, so then the other thing that we can is more to clinical. Then we ask you regarding the 6 cardinal position of your eye. So this cardinal position, when you look carefully, they are actually different from your so-called the primary, secondary, and tertiary functions. Let me give one example. So this one is your right eye that in front of you. Then you know that when you want to check the extraocular muscle, then you know that I want to identify the 6 cardinal positions. Okay, so for the eye to look to this direction for your right eye, the main EOM that in charge of this cardinal position is your superior oblique. Okay, so looking this way for your right eye, actually your eye actually doing adductions and also the elevation, right? Okay, but when you look at the superior oblique, there is no adduction at all over here. Okay, they're actually doing abductions. Okay, so you may confuse it. There is no adduction movement in your superior oblique. Why this cardinal position is responsible for your superior oblique? Okay, I sincerely hope that I confuse you all now. You will never confuse about this. I don't think it's a good thing because you need to have this confusion first. Then only you're able to further understand all the basic so-called the physiology and also the rationale in explaining your extraocular muscle. Okay, let's talk about the primary, secondary, and tertiary action of your EOM again. Yeah, in case in one point that you're unable to remember the table just now, whatever you memorized, something you lost. Okay, how should you remember back the actions of the EOM? Okay, so by understanding the principle is much more important than memorizing. Okay, so imagine that this is your eyeball. So it's always the orientation is like that. Your eyeball is this way facing the front. Okay, so for your horizontal rectus muscle is very simple. Okay, if this is your right eye, the medial rectus, because of the 0 degree of the insertion, so whenever it's contraction, you only have one movement, which is the adductions. Okay, so for the horizontal rectus muscle, it's very simple as well, because of the 0 degree of the insertion. Whenever it's contract, you have abductions of the movement of your horizontal muscle. Okay, so how about the rectus, the vertical rectus muscle, like for example superior rectus, inferior rectus, and also your oblique muscle, superior oblique and also inferior oblique. These 4 muscles share the same characteristic that you have angulations. So the first principle very important is the angulations of your muscle. Okay, so we talk about the superior rectus muscle first. So superior rectus muscle and also the inferior rectus muscle, you have to know that they have the insertion, there is an angulation of 21 degree. Okay, so this 21 degree, okay, is less than 45 degree. Okay, so it's quite near to the 0 degree itself. So you have to imagine whenever the superior rectus muscle contract, the primary action is still the elevations. Okay, the elevation of your eyeball. Okay, and also because of this angulation of the oblique CD, so when it contracts, so you have some kind of the intorsions. Intorsion become the secondary action of your superior rectus muscle. Okay, so also because of this insertion is 25 degree and come from behind to in front, so when it start to contract, so your eyeball will actually moving inward. Okay, so there is some of the adduction movement of your eyeball. Okay, so this is a function of your superior rectus. Okay, now how about the superior oblique muscle? Okay, so oblique muscle is a special in one way that it always come from the front to the back. So the way that it insert the muscle, actually it come from the anterior to the posterior, and also there's the angulations. And this angulation is much more compared to your rectus muscle. It's a 53 degree. It's more than 45 degree from your 0 degree. Okay, so also because of this the 53 degree of the angulation, and also when it come from the front to the back, so whenever there is a contractions of your superior oblique muscle, the primary action will be an intorsion first. Okay, your eye will be intorted because of this so oblique insertions. Okay, but at the same time, because of it still is come from because it's at the top, but however the orientation now is already different. So you have to imagine when it contract, it's a no more elevation even though it's come from the top. Okay, so now when it contract, because of this from anterior to posterior, when it contract, it press the eyeball down. So the secondary action become a depressions of the eyeball by your oblique muscle. Okay, so the tertiary actions of the superior oblique, then you can imagine when this insertion of this way trying to contract, what you do is you push the eyeball outward. Okay, looking outward, so it become an adductions, become the tertiary action of your oblique muscle. Okay, so the other important principle to describe the action of the muscle is as you know that the elevation of the depressions of your elevation and also the depression of your eyeball is in charge by your superior inferior rectus muscle and superior inferior oblique muscle. Okay, so when you talk about the superior rectus muscle, you know that the primary action is elevations. Okay, so imagine that your superior rectus muscle, there is a 21 degree of your oblique CD. So for you to have a maximum elevations, your eyeball, the orientation should be a 0 degree to your muscle. Okay, means that you should move your eyeball to the 0 degree of your rectus muscle or your superior rectus muscle. Then only your superior rectus muscle able to do the maximum job of the elevations. Okay, so you have to imagine your eyeball is always like this one. Okay, your insertion is 21 degree. So for your eyeball to move to the direction of your superior rectus, which is 21 degree from it, okay? So what your eyeball need to do is, your eyeball need to do abductions, okay? So when you abduct 21 degree, then they are two together in the same meridians, okay? Then any actions of your superior rectus will lead to the maximum elevations of your eyeball now, okay? So you always have a statement as the maximum elevation of your superior rectus muscle, it happens when the eye is in the abducted positions. Okay, it's because of these angulations, and because of this as well. So your cardinal position of your right eye is looking up and out is responsible by your superior rectus muscle. Okay. Okay, now we're using the same principle. We talk about the action of your superior oblique, especially over the depressions. Okay, so when your superior oblique, you know that the insertion is come from the front to the back. Okay, and also the 53° to the 0°. Okay, so when you also you know that there is a secondary actions of your superior oblique because you bring the eyeball down in the depressions. Okay, so the next important statement is in what position of your eyeball this depression is a maximum. Okay, so imagine your eyeball is always like that on your and your superior oblique is on top of this one. Okay, so the principle is your eyeball have to move to the directions of your muscle, the superior oblique, then only your superior oblique able to contract and bring your eyeball maximally down. Okay, so this position of eyeball should be adductions. Okay, so for your superior oblique to have maximum effect on the depressions, your eyeball should be in the adducted positions. So when your eyeball in the adducted position, your superior oblique muscle, even though the depression is a secondary actions, but now the superior oblique able to depress the eyeball maximally. Okay, so this become the so-called the cardinal position. Cardinal position for your eyeball to look down and in is responsible by your superior oblique muscle, because when you look in is already in the adducted position. That's why your superior oblique in this kind of position able to depress your eyeball maximally. That become the cardinal positions in the that responsible by your superior oblique. Okay, I hope that I able to clear some of your confusions, or can be either way that I'm more confused. Okay, so EOM actions I mentioned just now that already divide them: horizontal rectus, vertical rectus, and also the oblique muscle. Whatever that I explained just now regarding the angulations and also the maximum elevation or maximum depression in a certain locations, okay, is a very important principle you have to understand. Okay, so horizontal rectus muscle, very simple, only horizontal actions. So in the vertical rectus muscle, for example, superior rectus and also inferior rectus, first important thing is you know that there are 23° angulation relative to the visual axis in the primary positions. Okay, so the primary vertical actions also is due to the elevation is responsible for elevation by the superior rectus, depression by your inferior rectus. Okay, then the next statement you have to say the greatest elevation with the eye of your superior rectus is in the abducted position. Same for your inferior rectus, who the primary action is the depressions, but the greatest depressions is in the abducted positions. Okay, this statement actually responsible for the cardinal positions of the eye that usually we will use when we check extraocular muscle movement. Okay, and also because of these angulations, you have a secondary torsions and also tertiary adduction motions. So for the oblique muscle, it's kind of opposite of the superior rectus and inferior rectus muscle. So the primary is a torsional actions also because of the angulation is so big. So the primary action is a torsions. Okay, 51°. So also because of this 51° of the angulations, okay, your secondary action of the SO, which is the depressions, have to be you want to make it have a maximum depression, your eyeball have to be in the adducted positions. Okay, so when your eyeball in the adducted positions, then only the depression of your superior oblique able to have a greater depressions by your superior oblique. Okay. Okay, so actually the simplest way is still memorizing it. Okay, so that yeah, because in the MCQ or some of the Q&A you may have no time to think back of this principle. Okay, but the principle is very important for you to understand so that to memorize better, and also just in case that you are able to memorize it, what you can do during your answering is bring up your hand, okay, and then don't worry, the examiner will not think that you are dancing anything. Okay, just do whatever that I mentioned to you just now. Then with the principle, you will be able to recall back all the important principle and also the action of your extraocular muscle. Okay, the next few last slide that I'm going to show you is basically the description of the functional system of your eye movement. Okay, the important one is definitely is the saccade and also the pursuit. Okay, and also the vestibular ocular reflex, and also the other functional class like optokinetic and also the vergence. Okay, so I put all the description over here. Okay, yeah, if for you to you can get it from the books. Okay, so the template is always start with the definitions and then you talk about the character. there's no other way besides memorizing all the velocity and also the latency of the certain functional class. But for the anatomy and also for the physiology functions, I hope by all my explanation just now, you're able to make it much easier for you to understand. Okay, so to describe the anatomy in the saccade in the functional class, for example, saccade, pursuit, and also vestibular ocular reflex. Okay, recognize the highest anatomy structures that involve first. Okay, as we mentioned, saccades and also pursuit, they always start from your cerebral cortex. Okay, as mentioned, which part of the cerebral cortex is involved, and then go to your subcortex. Okay, and also then the important point over the saccade and pursuit here is whether they cassette or not. Okay, so saccade, the cassette of the midbrain, that's why in the fundal eye field on one side, they're responsible to the saccade movement of the contralateral side. Okay, pursuit, did the fiber actually decassette? Yes, they decassette. But however, they have double decassette at the pons and also cerebellum. So at the end of this, because of the result of the double decassations, so the pursuit system is actually in charge of the ipsilateral cortex in the temporal lobes. Okay, so after when you go to the gaze centers, then you start talking about the gaze. So saccade can have a vertical and horizontal gaze. Okay, so when you talk about saccades, we still need to talk about the gaze center, even though there is not a main point here in the descriptions. Then only you talk about all the neural component and also the tracts that involve, and at the end it go to the extraocular muscle by the certain nerve that in charge for the movement of your saccades. Same thing for the pursuit as well. So pursuit also you have a vertical and a horizontal pursuit. Okay, so start from your cerebral cortex, go to your subcortex, and also go to your in the brainstem of the so-called the gaze center. That just mentioned that in case you want to have a vertical pursuit, okay, the impulse will go to the midbrain. You want the horizontal pursuit, the impulse will go to your the pons. Okay, so it's different from the question that the other question we can ask you: how do you perform horizontal gaze? Okay, so in horizontal gaze, then the pursuit and saccade become a optional component, not the optional component, become a small component. But you need to start first. You just mentioned that in the cerebral cortex, then your brain will decide whether you want to do a pursuit movement or saccade movement. But at the end, any of this impulse will go to the gaze center that located in your brainstem. Okay, then you tell me which part of the brainstem, which reticular formations, and also which neuron component, and also the tracts in the reticular formations that are responsible for the movement. And then you give me some example when patient want to look to the left, what kind of cranial nerve and what type of the signal that actually is a fired that for you to move to the left and also the right. Okay, let's talk a bit about the vestibular ocular reflex. Okay, so compared to the saccade and pursuit, this is involuntary eye movements. That's why we call it a reflex. That's why you can see that in the anatomy, there is no involvement of your cerebral cortex and also the cortex. Okay, the involvement is come from your sensory organs of your semicircular canal and also the utricle and also saccule in your ear. Okay, so at the end, there you go to the vestibular system. Yeah, so there's the place where your cranial nerve is involved. Then go to your nucleus, as we mentioned just now, within the pons and also the macula. But the cerebellum and also the cortex is may involved in some of the so-called adjustment, because you still need to decide saccade and also pursuit movement by your cortex, and also you need the cerebellum for the modifications. But the key organs that in charge of this vestibular ocular reflex is not come from your cortex. That's why it will bypass so-called the cortical functions. It becomes an involuntary movement, it becomes a reflex. Okay, so very important to mention that this system at the end is crossed over to the contralateral gaze center. Okay, so whenever the impulse from one side of your ear will go to the contralateral gaze centers, and then you depends on the movement of your head, then all these gaze center go through your all the important neural tracts. For example, the medial longitudinal fasciculars, and also the posterior commissure, then to go to the different vertical and also horizontal movement, and also different movement to compensate of your ocular, compensate for your head movement by the different cranial nerve. Okay, these are the other so-called the functional class of the ocular movement. They are not as important as what we discussed just now, the saccade, pursuit, and also the VOR. But it's always good to have. I just put the slide over here for your reference. Okay, so I think that's the end of my lecture for today. Thank you very much for your attentions. I sincerely hope that it will help you to at least able to understand and also to to prepare your answer for the ocular motility questions, either in the anatomy or either in the physiology. Whatever we discussed just now, they are not like the classical question that we're going to ask you and then what is the classical answer. No, yeah, they are the general so-called understanding regarding this system, okay, and it should be able to apply to any type of the questions they're going to ask you regarding ocular motility. Thank you again for your attention. Thank you.